Students, in this lecture, we will discuss India's contribution to the world in medical sciences. This topic is a part of Understanding India, which is a valuable value-added course of University of Jammu, University of Kashmir, Cluster University Srinagar, University Jammu, and many other universities. Students, you know, India is an incredible country of a plethora of rich resources and talent. India has made noteworthy contributions to the world since time immemorial. It is not only having good natural resources, it is also having good human resources also. It is described as Durlabam Bharte Janma in Sanskrit, which means it is rare to have the opportunity to born in India. This Sanskrit line shows the greatness of India. As a peace-loving country, India had given contribution to the world in many aspects like culture, administration, music, dance, science, technology, etc. From ancient times up to modern age, it is acting as a guide to the world, as it is spiritual land also. So many philosophers, travelers, thinkers have visited India and learned a lot of things. They have appreciated India and had given the place of guide to India. The Indian had given the valuable contribution in all fields, including culture, to ultra modern science and technology. The fields like art and architecture, Ayurveda, astronomy were much developed by Indian intellectuals in the ancient time. In this lecture, we will discuss the contribution of India to the world in medical sciences. You know, India in the ancient time, India has contributed a lot to the medical sciences. Here in this lecture, we will discuss two personalities. One is Charaka, another is Sushruta. First, we will discuss Charaka. The history of medical medicine is rich and famous. Its oldest ideas are found in the sacred literature known as Vedas, particularly the metrical portions of the Atharveda. The creation of medical treatise known as Charak Samhita and Sushruta Samhita credit to Charak credit to Charaka and Sushruta Samhita is credit to Sushruta. Charaka is a physician which has contributed a lot and Shruta was a surgeon. Will discuss in detail. Charaka was born around 300 BC and a key contributor to Ayurveda, ancient art and science, medicine and lifestyle philosophy. He lived between 150 to 200 AD and 100 BC. He is well known as the editor of medical treatise called Charaka Samhita, one of the basic book of traditional Indian medicine and Ayurveda. According to Charaka ideas, health and sickness are not predestined, and human effort and attention to lifestyles can prolong life. According to Indian tradition and Ayurvedic system, prevention of all form of ailments is more important than treatment, including lifestyle restructuring in line with the rhythm of nature and the six seasons, which will ensure overall health. Charaka has studied all part of medicine, including the logic and philosophy underlying the Indian medical system. He placed a specific focus on the illness diagnosis. He regarded Ayurveda as a holistic system of healthcare that addresses both preventive and curative elements. He also elaborated the topics such as fetal production and development, physiology of human body, and function and malfunction of body. According to Charaka, a body has a, a body works because it has three doshas or principal movements principles. First dosha is vata movement, second is pitta transformation, and third is kapha lubrication and stability. These dosha correspond to the Western categorization of humor, wind, bile, and phlegm. They are created when dhatus, known as blood, flesh, and marrow, interact with the food consumed. However, for the same amount of food consumed, one body creates dosha in a different amount than another. That is why one body differs from another body. Furthermore, he emphasized that disease is caused by a disruption in the equilibrium of three doshas in human body. He suggested medicines to help restore balance, although he was aware of microbes in the body, but he did not regard them highly. Charaka Simhita. It is an Ayurvedic treatise, means Indian traditional medicine written in Sanskrit. The Charaka Samhiti is one of the two Ayurvedic fundamental texts, the other being the Sushruta Samhita, which we will discuss later in this lecture. It remained a classic text on the subject, which has been translated into foreign language including Arabic and Latin. The current version of Charaka Samhita is said to have been developed in the first century. In the 7th century, In the 7th century, Agnivesha, under the supervision of the ancient physician Arteria, compiled the Agnivesha Samhita, an encyclopedic medical compendium. However, the text lacked depth of knowledge and was not up to date in terms of quality, so very little attention was paid to the task. However, later Charaka updated the Agnivesha Samhita and called it Charaka Samhita. Charaka organized the treatise into eight sections or ashtangas sthanas. The author Dabala later added 17 chapters to the Charaka Samhita. According to this Charaka Samhita, there are four key components to medical practice. The first one is the patient, second one is physician, third is the nurse, fourth is the medication. According to the scripture, all four are necessary for rehabilitation in restoring health. The Charaka Samhita, like most ancient Hindu literature, reveres and credits Hindu gods as the true source of its knowledge. Students, students, our next topic is Sushruta. Sushruta was ancient Indian surgeon who was possibly born in 7th century and is author of the book Sushruta Samhita. In Sushruta Samhita, He describes our 120 surgical instruments, 300 surgical procedures, and classify human surgery into 8 categories. In the Sushruta school, the first person to expound Ayurvedic knowledge was Dhanvantri. Dhanvantri taught it to Divodasa, and then Divodasa taught it to Sushruta. Sushruta is credited with performing cosmetic surgery, especially with using forehead skin to reconstruct noses which were amputated as a punishment for crimes in his era. In ancient India, medical science supposedly made many advances, especially these advances were in the area of plastic surgery, extraction of cataract, and dental surgery. There is documentary evidence to prove the existence of these practices. The practice of surgery has been recorded in India around 800 BC. This need not come as a surprise because surgery, which is known as Shastra Karma, is one of the 8 branches of Ayurveda, the ancient Indian medical system of medicine. The oldest treatise dealing with the surgery is the Sushruta Samhita. Sushruta, who lived in Kasi, was one of many Indian medical practitioners who included Atraya and Charaka. We have already discussed about the charaka. Sushruta was one of the first to study the human anatomy. In Sushruta Samhita, he has described in detail the study of anatomy with the aid of a dead body. He has used a dead body to study the anatomy. Sushruta 40 was rhinoplasty, means plastic surgery, and ophthalmology, that is the ejection of cataract. Sushruta has described surgery under 8 heads: Chedya, which is excision; Lekhya, scarification; Vedya, puncturing; Asya, exploration; Arya, extraction; Vasraya, evacuation; and Sivya, suturing. These were the 8 heads where the Sushruta has described the surgery. Sushruta was known for 3 types of studies. First one is the ophthalmic surgery. So Sushruta was specialized in ophthalmic surgery, which is the extraction of cataract. It is a typical operation performed by Sushruta for removing the cataract of eyes. The second one, which Sushruta was known, was the plastic surgery. Perhaps it is the greatest contribution of Sushruta. A detailed description of plastic surgery in the Sushruta Samhita is amazingly meticulous and comprehensive. There is evidence to show that his success in this kind of surgery was very high, which attracted people from all over the country and perhaps even from outside. The details of step of this operation, as recorded in Sushruta Samhita, are amazingly similar to the steps that are followed even today in such advanced plastic surgery. It was mostly performed for the amputation of nose, which was very common in those days. Another study was the anatomy. Sushruta was the first one who has studied anatomy of human body. He has described detailed study anatomy with the use of dead body. Various accidental injuries that affected every area of human body was described by the Sushruta. First one is chinna, which is the complete amputation of a limb. Binna, a lengthy penetrating item, was penetrated deeply into a hollow part of body. The third one was Vidha, which is puncturing the structure without creating a void in the body. Next one is Shata, which is an injury in which there is evidence of laceration on both the chinna and pinna sides. Vichita. is another injury which is caused by falling or being stuck. Grasta is a skin abrasion at the abdominal level. All these were the six types of unintentional injuries which were described by Sushruta. Ayurveda is basically indigenous system of medicine in India. Ayurveda literally means the science of living. Ayu means life and Veda means knowledge. The origin of this system of medicine are lost in the hoary past, and the body of knowledge that comes under the heading Ayurveda constitute ideas about disease, diagnosis and cure, which have been accumulated over the age past. According to Charaka, a physician who fails to enter the body of patient with a lamp of knowledge and understanding can never treat disease. He should first study all the factors, including the environment of patient, which influence the patient disease, and then prescribe treatment. It is more important to prevent occurrence of disease than to seek a cure.